The National Veterinary Research Institute was established in 1924, so we're just a few years from the centenary celebrations of the institution. And it was established on the back of a pandemic of a disease of cattle known as reindeer pest. In the late 1890s into the early 1900s, this disease devastated the cattle population, not just of Nigeria, but the whole of the West African sub-region, by up to about 90%. So this prompted the colonial government then to establish the National Veterinary Research Institute. It started as a veterinary service in Zaria in 1913, but in 1924 it was moved to VOM in its present location. And so the mandate of the institution has developed from being a serum production institution over the last 90 years to a broader based institution. First, we conduct research into all aspects of animal diseases, their treatment and control. We also produce animal vaccines. Currently online are 20 different animal vaccines that we produce. We have 3 that are coming on stream before the end of 2021. We are also responsible, we are the national laboratory responsible for disease control and surveillance. That means that any animal epidemic or disease, we confirm it and we send up the report to the ministry for reporting to other international agencies. We are also responsible for extending veterinary services, not just for farmers, whether they are livestock farmers, poultry farmers. We have extension services, we have liaison services, we have advisory services that we provide to farmers. So in a nutshell, that is what NVRI is. Under this administration, we would like to put on record our gratitude to the President for always supporting us. Through the Ministry of Agriculture, we have been supported and we have continued to produce vaccines for the control of animal diseases. Even in spite of COVID, even during COVID, we kept our laboratories open to produce vaccines. We are also part of the network of COVID testing laboratories in this country. So far, we have tested over 50,000 COVID samples in our Biosafety Level 3 laboratory, which has been kept open through the support that we have received from the President, Muhammadu Buhari, and his administration. During the early days of the pandemic, we supported the effort of controlling, of testing by producing what is referred to as the virus transport medium, which is used for collecting samples between where you collect the samples and taken to the laboratory for testing. And this has been through a lot of the support, like I said, that we have received through the government, and we are very grateful to the President for that. We have just commissioned a laboratory in Lagos. This laboratory was built with the support of the government of Lagos State. The governor of Lagos State, actually, when he was in charge of the LSDPC, initiated with an arrangement between us and the LSDPC, started the building of this particular laboratory. And the laboratory is able to do not just diagnostic work, but with that laboratory we are able to go around one region of the country without moving from VOM to be able to diagnose diseases. If you probably recollect, there has been a certain outbreak of a disease known as monkeypox, and we have been in the forefront of diagnosing this disease and collecting samples, and our Lagos laboratory is central to the collection of the samples for us to be able to diagnose the monkeypox disease. The challenges mainly are around our mandate areas. One of our major challenges is that some of our facilities are aging and obsolete. For example, our vaccine production facility started in the 60s, so it is, now due for an upgrade. The facilities are no longer fit for purpose. We need support to be able to bring up our laboratory to what is referred to as a GMP, good manufacturing practice, and that will help us to scale up the production of the vaccines, distribute it not just around the country and around the region. We can actually export our vaccines to any part of the world. Other challenges are to do with, again, not just the laboratory facilities. For us to be part of the laboratory networks, international laboratory networks, we have to be certified by what is referred to as the international standard organizations. We have a system of certification of laboratories, diagnostic laboratories, known as ISO 17025. So we have to put a few things in place, upgrade our facilities, retrain our staff, so that we are able to continue to provide surveillance and diagnostic services around the country. Like I said, we are the national laboratory. We have 23 other laboratories around the country, 6 are zonal, and the other 17 are in strategic states around the country. But we need to have them upgraded with new facilities, with new training, so that we can continue to discharge our mandate of surveillance and control. Another issue is 70% of infectious diseases around the world now that affect humans come from animals. So it is very important that we control diseases in animals so that they do not jump into the human population. We are designated as a Zoonotic Center. That means that the diseases that are shared between humans and animals, for example, tuberculosis, rabies, monkeypox, even COVID, we need to do research on these diseases, keep them under check, keep them under surveillance so that they do not jump into the human population. If you control these diseases in the animal population, then invariably you are controlling it in the human population. And this is very key. It is a very important mandate for us. We are part of what is referred to as the One Health system, which has to do with veterinary medicine, human medicine, and environment, working together to see that we control diseases, be it from wildlife, from animals, or from human. And so our laboratory in VOM is very important and is key in this One Health program and in controlling zoonotic diseases. We have a master plan, what we call a strategic plan in place, 2021 to 2025, where we have mapped out what we think we need to do to reinvigorate and reposition the institute. First, we want to, like I said, upgrade our vaccine production facilities. We would also want to ensure that all our zonal laboratories, diagnostic laboratories, are in line and functioning.